So today we're going to go over very comprehensive labs your doctor needs to be ordering beyond LDL cholesterol, especially if their only approach was to give you a pill without addressing all the multiple factors as to why your cholesterol is elevated in the first place. Because you have to understand, the second you start taking something to lower that cholesterol, your mitochondrial function will suffer, and that's a big problem.
So this is the panel that you are probably used to seeing, obviously your triglycerides, your LDL cholesterol, which this patient had some concerns with. So we decided to dig deeper as to why this is elevated. And sure enough, we did an advanced cardiometabolic panel. A few months later, her LDL cholesterol actually dropped down to normal and healthier ranges. But what you need to understand here is markers like small density LDL, CRP, and homocysteine are very important vascular inflammatory markers, which can also increase blood pressure and increase risk for cardiovascular events, instead of just looking at LDL cholesterol. And I'm very glad we got this complete approach tested, because we can see her lipoprotein little a is still very elevated, which tells me she's not in the clear here. We have a lot more work to do to understand why is this marker so elevated. Now, doctors will tell you that your cholesterol might be genetic, or your LPA, there's no ways to change that, which we have to start making the connections. Like this patient has inflammation to her digestive system and dysbiosis, which is directly contributing to endotoxemia and elevated response of LPA cholesterol. And sure enough, we see that gut barrier dysfunction here with a patient like this that has an elevated response like that, especially with calprotectin levels being this high. You guys, we want to see these markers calm and collected. And if they're not, they're directly going to create that inflammatory response and increased oxidized cholesterol, which is a big problem.
So the research behind oxidized cholesterol going up is there. There's a connection between lipopolysaccharides, endotoxemia, which are fancy words for just toxin overload to the digestive system, which is putting a stress to your cardiovascular system. Is your doctor making these connections? Are they testing beyond that LDL cholesterol and helping you understand what your nutrition should look like and how to support your gut pathways to make sure that your cholesterol is being balanced appropriately?